Oftentimes when people are having a stroke, it doesn't hurt like a heart attack. So oftentimes families wait and actually delay calling 911. And then when EMS personnel first show up at either the patient's home or their office, wherever they have the stroke, they literally have no tools by which to treat the stroke at that point in time. So they have to stabilize the patient and transport them to the hospital. And even then, once the patients arrive at the hospital, a number of diagnostic tests have to be performed on that patient to evaluate whether it's been a bleed or a blockage. And sometimes those tests can take up to an hour. The only treatment for an ischemic blockage is a drug called TPA, tissue plasminogen activator, and that has a limited window in which it can be used, and it needs to be only used within 3 hours of when the patient first had symptoms. So if a patient falls out of that window, or if the patient woke up with stroke symptoms and they don't know when they started, that patient would not be eligible for TPA. So if you look at all the patients, less than 5% of stroke patients actually receive TPA, which means 95% of patients don't receive any treatment whatsoever.